So we had 10 glaucoma patients and 10 control patients. We looked at 4 common positions that have never been tested before. We know that the headstand position doubles IOP. That has been tested for years. So we wanted to look at common yoga poses that are done in everyday classes. A lot of the patients who come into the clinic ask if they're allowed to do yoga. We had no clear answer, so we decided to do this study. And basically all 4 positions we found increase IOP immediately. Most of the positions did increase up to higher, up to 70%, even 50% of their IOP. And the most significant was the downward dog position, which is the most common position, which is also a transitional pose during all yoga classes. So we did find that this was really significant for glaucoma patients as well as control patients. So we had each patient, took a baseline pressure while they were seated. They went into the yoga position for 2 minutes. I took the pressure immediately assuming the position and at 2 minutes. And as you can see from the data there, the pressure does increase immediately and stays up during that 2-minute period. They were then seated, we took the pressure. Pressure did come back down as soon as they were seated again, however not back to baseline. We waited 10 minutes and took the pressure again. As you can see, some of them, the pressure did come back down, but also not all the way to baseline. Then we went into the next yoga position. We're not really sure. I would say definitely the inversion with the head being below the heart, increasing venous pressure and dropping the perfusion pressure. But we're not exactly sure. This was simply a pilot study to get some quick data. I would like to expand this study to not only more participants, but also hopefully potentially to a full class, not just 4 positions. Definitely. Patients right now, we're asking them to modify positions, try not to do complete inversions. And also, people who may have a genetic history in their family of glaucoma to be aware of this as well if they are yoga practitioners.